Love this question. What do you look for when you're shopping around for an explant surgeon? So here's the first thing I always recommend is you want to make sure your surgeon is a board certified plastic surgeon. They have privileges at a local hospital, and they're also members of our national society. Of course, American Society of Plastic Surgeons, and then also I love the Aesthetic Society, so American Society of Aesthetic Plastic Surgery, and I think that's very important. Second, you want a surgeon who practices evidence-based care, and you want them to treat you as an individual. So they shouldn't have a cookie-cutter approach to every single explant. They shouldn't say every explant gets a capsulectomy, every explant gets fat grafting, every explant gets a lift. They should look at you, discuss your health problems, figure out if your capsule's abnormal, and make an individualized plan for you. So it's very important when you look at their befores and afters and they say what surgery they had done, did every patient get the same thing? The next thing, of course, is look at befores and afters and make sure that this is something they do frequently. Like I said, make sure they do different iterations of this surgery, and then also make sure they get results that would make you happy. The next thing I think is important is how does your surgeon behave publicly on social media? Do they give factual information about explants that is evidence-based, or do they fearmonger? Because fearmongers usually do that because they're trying to scare you into seeing them. If they are breeding distrust in the plastic surgery community in order to profit off of you, probably not the best choice. And then finally, you want to make sure that your surgeon isn't doing weird things without evidence and not studying it. So if your surgeon is doing strange things that are out of the norm, if they're doing EKGs on you for dubious reasons, if they're recommending very expensive supplements as a detox for dubious reasons, and they're not being honest with you about what evidence there is to support those practices, run away screaming. So women getting explants deserve the same high quality care that every patient in every area of medicine deserve. And so you want to make sure when you're getting your explant that you're getting that. And unfortunately, there's a bit of a fringe group within my community that doesn't provide that. And they fearmonger and they do all of the things opposite to what I just mentioned. So make good choices, go see someone who practices evidence-based care and will give you a fabulous individualized plan and result.